In addition to its supported medical assessment, MedConcerns offers other communication support tools and resources. From the drop-down menu, you'll find communication boards, including a needs board, a topic board, and a yes/no board. There is also a whiteboard available where you can draw, add pictures, and type, as well as aphasia-friendly post-stroke aphasia and apraxia education. Any of the screens from the medical assessments can be found within the drop-down menu and accessed directly, including the pain scale. For customization options, from the drop-down menu, the settings screen can be found. Since people with aphasia vary in the number of icons on a page that are best for their understanding and sensory needs, in settings, users can modify the number of icons per page from 6 all the way down to 1. Additionally, if visual acuity is a barrier, the app has a zoom feature to allow users to get closer up for better viewing. In settings, the gender of voice used in the app and the body shown in the pain assessment can be selected, and the app can be translated from English to Spanish. Different providers and patients may have different needs as far as the problems listed on the concern screen. Since eliminating irrelevant content supports understanding, the concern screen icons can be removed if they are not applicable or necessary. Icons can easily be added back to the concern screen by returning to concern settings. In the same way, icons can be added or removed from the needs board in the needs board settings. Now we'll look a little bit more closely at the communication support tools MedConcerns offers. The yes/no board can be found in the drop-down menu or at the bottom of the screen on the navigation bar. It can be used to verify responses and to help avoid communication breakdowns.
Yes.
The whiteboard can be used to communicate further on any topic, using any image from the app, drawing, or typing. The whiteboard can be found in the drop-down menu or on the bottom navigation bar. We often see printed communication boards given to people with aphasia and other communication barriers when they enter the hospital. Although they might be useful, communication needs are seldom one size fits all. As a result, these communication boards often go unused. The needs board within the MedConcerns app is more customizable. Users can change the number of icons per screen for easier viewing, and they can remove icons that don't pertain to them. After a stroke, brain injury, or other event that leads to hospitalization, a person is left with many questions they'd like to ask their provider. Unfortunately, people with aphasia often lack the ability to ask these questions and may be left out of the conversation. The topic board is an important communication tool as it enables the person with aphasia to guide conversation with their provider.
What happened to me? Yes.
For a person with aphasia or related disorders, it is often incredibly difficult to understand what has happened and why they are having difficulty communicating, even if they've been told by various providers. If those conversations haven't included aphasia-friendly language or communication supports, comprehension can be severely reduced. Under the Patient Education tab in the drop-down menu, the MedConcerns app contains a simple overview of aphasia and apraxia to help the person to begin to understand what they are experiencing and what tools may help them. MedConcerns was created to make using supported communication easier, more efficient, and more consistent for healthcare providers. With this app, people with aphasia can depend on us to use the techniques that work and to uphold their right to effective communication in healthcare.